one concern that we hear is just the success rate. Like, what's the success rate of the All-in-X procedure? And it's a very valid concern. Patients are investing a lot of money in this treatment, and a lot of times they're, getting this procedure because of other failed dental procedures. And so they're wanting this to be a solution that can last them a long time. And so what I will say is typically implant failure rates is around like 5%. And so the normal success rate would be 95% of implants being placed and integrating with the bone. I'll show this video just to go over a little bit of how it all works. But the implants are placed, and then we attach a set of teeth to the implants the day after their surgery. But what needs to happen is the implants need to integrate with the bone. And so some of the things that can cause those implants to fail during that healing process of about 3 months is chewing and eating foods that are not recommended. So eating hard foods. We typically have patients stick to a soft food diet. The rule of thumb is if you can cut it with a plastic fork, then you can eat it. And so that would be something that could cause the implants to fail. Another thing would be smoking, and smoking reduces or limits blood flow to those areas, which then reduces the ability to grow bone or have the implants osseointegrate within the bone. And so that's another thing. And then same with diabetes. Diabetes can affect healing. And so those are some of the main factors would be during that healing process, eating foods that you shouldn't, smoking, and then diabetes. And what we do for any patients that don't smoke and don't have diabetes, what we'll do is if an implant does fail during that healing process, it's really simple. Honestly, we'll take out the implant, we'll place in a new one, and then we'll let that implant heal. And then we just continue to move on as normal. So it is very unlikely that the implant does fail, but in the case that it does, that's something that we do at no extra cost to the patient. If the patient is smoking, we'll have a conversation with the patient about stopping before surgery and allow the implants to heal and give them a better chance to heal. If the patient is smoking, then we will have a conversation with how much we would charge if the implant fails, where we got to take out the implant, place in a new one. We typically just charge what our cost is. So the cost of the implant, the cost of the sedation, and then the time for the doctor to be able to go in and do that. So we try to be as fair as possible and as upfront as we possibly can. But the overall success rate of this treatment is extremely high. And those are just some of the factors that could increase the chances of implant failure.